Hello, and good afternoon, everyone. Thank you for joining us today for our seventh episode of Cheetah Chat. My name is Dr. Tashina Reeder, and today our topic is on who is Philadelphia Fight Community Health Centers and who we are not. And today we have the CEO of this organization, Jane Scholl, who will be sharing with us today to inform you about this organization that is well known in the community. Hello, Jane. How are you?
I'm good. How are you?
Good. Thank you for joining us today.
Sure.
So let's get right into the conversation. So recently, there has been a lot of um, bad press in the media, specifically to the organization who goes by the name of Philly Fighting COVID. It's an organization that has been providing COVID vaccination to folks in the community. And as a result of this bad press, unfortunately, um, it has um, impacted this organization, and so we want to be able to speak truth to who we are and who we are not. All right.
Right.
So the first question is, can you tell me a little bit about Philadelphia Fight Community Health Centers and the impact this situation has had on the organization?
So I think the important thing is we are health centers. Um, we are what's called a federally qualified health center, which means we've been designated by U.S. Department of Health and Human Services. They fund us, and we have access to other resources. And the reason that they do is because the goal is to be able to be open to anyone who wants to be our patient, regardless of whether they have health insurance or not, if they have Medicaid, et cetera. And we're able to take care of people. What has happened is, so we are Philadelphia Fight. What happened is that a new organization called Philly Fighting COVID turned up starting last spring. In the beginning of the pandemic last spring, they were a bunch of graduate students at Drexel. So I think they may have been engineering students. So they had what's called 3D printer, which means you can kind of manufacture things if you have the raw materials and the specification. And so they started making PPE, personal protective equipment, for healthcare workers, which was a good thing. They were doing that. Then, when the city wanted to encourage organizations to do COVID-19 testing, they also branched out into COVID-19 testing. There was a period of time when they were doing, I believe, no barrier testing. Fight was and is doing no barrier testing, and the Black doctors are doing low or no barrier testing also throughout the city. No one else is. So that was not like a bad thing. So by no barrier testing, what do we mean? We mean that we'll give a COVID test to anyone who needs it, who feels they need it for any reason. You do not need a prescription. You don't need to be sick, and you don't need to make an appointment. We're there specified hours. That's the sort of no barrier, and you will not be charged. There is, in fact, a federal fund that should mean no one is charged, but people are being charged in a lot of places. We don't charge people, so it's fine. They did that. I believe that they were having some more difficulty than we were with community partnerships because we've been here for 30 years, more than 30 years now, and we have established community partnerships that we've been working with. The problem came when the city was looking for someone to do a mass testing site at the convention center that originally was for healthcare providers only. And for some reason, they turned to this new group, Philly Fighting COVID, or PFC, um, and asked them to operate it. There was no one at Philly Fighting COVID who, when this happened, who was medically trained. They didn't have any doctors. If you looked on their website at that time, you had to keep going through screen after screen after screen before you would find anybody who who was a doctor. So they start operating the site. Um, what they did know how to do was create an online sign up. This, of course, has been another problem because one of the first things that the COVID pandemic did, and that we're still not out of, was low income people lost broadband access to the internet. Computer labs closed all over the city, that mostly they're still closed. The free library closed its computer labs. People didn't have access. The only way realistically you could get an appointment for the convention center really was if you had broadband. You probably could do it on a smartphone, but like for example, the Obama phones are not smartphones. Everyone doesn't have a smartphone. And there was no phone number that you could call anywhere on their website until very recently. So they set them up, and then a lot of mess, which we can discuss further, happened. The city, in the end, with broke the partnership. A deputy health commissioner was forced to resign over having partnered with them, and also another number of other things. Philly Fighting COVID is still saying we did nothing wrong. The city's fighting with them, So it has been a big mess. I also would just say, as a sort of general point, it's not totally directly related to us. The city, whoever really did this, chose to work with Philly Fighting COVID when the Black doctors had demonstrated, and they'd been demonstrating for months, that they were capable of operating a mass testing site, when the Black doctors, in fact, are a coalition of, I believe, 36 physicians, and then they've recruited a lot of volunteers. And it's quite likely they would have had the expertise to do it. And they certainly wouldn't have done some of the things that Philly Fighting COVID did, like the president of that corporation took a bunch of vaccine home with him, and he injected his girlfriend and his friends. I mean, you can't do that. So issues like that. All right, so how did it start affecting us is that our name seems similar.
Mhm.
And, we have a lot of hashtags that are using Philly Fight, right? Or they're using, ICJ Philly. I mean, we're doing that because nobody thought it would be a problem. But I think, because of that made it more complicated. And since the COVID testing they were doing started, which was sometime last summer, I think, we kind of had a low volume of calls of people thinking that we were them. We started having a higher volume of calls of people thinking that we were them when they were doing vaccination because they couldn't get through, right? And then when it all blew up, we started hearing from people that they thought we were that group. And it's like we got direct phone calls to us, which is actually not a big problem because we can correct it. Although it takes time, but we got our website was getting comments. But what's more concerning is that people who knew our board members were calling our board members and asking about it. We had funders calling the people who they worked with and saying, what are you doing? One of our funders in Washington, the National Institutes of Health, where we don't have that funding, but the Wistar Institute at Penn does, and we're partnered with that. They called the Wistar Institute and said, what has this group that you work with gotten into? And so that's kind of bad. And so we put a statement out. We tried to send it to everybody, every name on, any email list that we had, and to the press and so on. It's on our website, because we just want people to really understand we're not them.
Mhm.
So that's the story.
But thank you for sharing the story behind all of this confusion that seems to be taking place and continues. And I can imagine, I mean, it can be pretty stressful having to navigate and differentiate ourselves from them to the point where we actually have to change some of our hashtags and website handles and things like that so people can understand that we are Philadelphia Fight and not the other organization, right?
Yeah. Yeah.
Right?
Yeah.
Well, at the same time, I know that when this whole debacle hit the news, people had received their vaccinations through them and were concerned because they realized, oh my gosh, how am I going to get my second shot? What all does this mean? There was no clarification of the next steps. And so I imagine people are experiencing some mistrust, which is something that, the health field tries to fight to work through and advocate, as to why we should trust the medical profession. So can you speak to how this situation could contribute to this mistrust of the medical field?
Yes, I think that that is actually the biggest problem that this may not have created, but it certainly it contributes to it. So, we have history here. I mean, if you are African American or Latino, any minority in America, you have every reason to be suspicious. Every reason. I mean, we have the famous Tuskegee experiments, which of course were not the only one. We have had numerous examples of unequal treatment of, a black person and a white person in the same situation, within the medical system. During AIDS Education Month, one of the workshops we did, which Dion Powell, who's our chief legal counsel, put together, was, specifically with Frank McClellan and Mario Cruz. Mario Cruz is our director of pediatrics, and Frank McClellan is a malpractice attorney, where they talked about experiences that their patients have had. And so this is an issue. I think the second issue is, it is certainly true that this vaccine was developed really quickly. And I know that many people are very hesitant about it because it was developed so quickly. Now, I think that there are arguments that can be made that I myself think are convincing about this. One of them, and I'm going to say this in a way that's different from the way it usually gets said, because of so many things that have been learned during the AIDS epidemic and understanding the immune system, and that really is a factor. Scientists know so much more about it now that they don't have to make a vaccine in the traditional way, which would use a small piece of the COVID virus itself, either inactivated or dead, right? They don't have to do that. They've learned how to manipulate the genes so that these vaccines, the ones that have been approved so far, are all similar in that there's no virus there. And I think, I believe that the research um, is sorry, is convincing.
Mhm.
But at the same time, it's like unclear whether people would, like I think it's harder for people to be convinced. And there's enough terrible history for people to be worried. But I also think that, one of the issues that we really face in relationship to who's acquiring COVID is that there are very large numbers of people who have absolutely no choice but to be in public facing positions.
Mhm.
They're driving SEPTA buses, or the regional rail, or SEPTA trolleys, which are really buses. They're working in food service. They're interacting with the public there. They may be working in healthcare, but in areas where they're interacting with the public. They may be working in nursing homes. And, the structure of these jobs is that you really do have a lot of people of color in these jobs.
Mhm.
And what would be, I think, really unfortunate with this whole thing blowing up the way it did, it would be if people were to say, oh, now I see this, how can I trust anybody? Although I mean, it took the city days before they actually started getting accurate information out to people who had gotten their first shot. And because I knew a couple people who got, they're sort of emailing me or texting me every day, like, I haven't heard anything. They finally did. But I think, they either did not recognize how stressful this is, that if you've gotten your first shot, then you're really stuck. You have to go back and get your second shot.
Mhm.
Or, they just could not, um, access the database. It's very, hard to know. But there's a lot of reasons not to trust this. And I think it's hard because there are a lot of reasons not to trust the vaccine, not to trust the impact. But I hope that this is not going to influence people not to get the vaccine. And I think right now, we have one big mass vaccination trusted provider with the Black doctors. And, it's like everybody should sign up on the website. I mean, we also have other issues in the city of Philadelphia, which are policy, which are unfortunate, which, are related to, for some reason, Philadelphia has chosen not to follow the guidelines that the state of Pennsylvania has. So as a result, everyone with HIV, if you live in the Philadelphia suburbs or anywhere not in the city, you're eligible right now. You can find out where your county's doing vaccination. You can get a vaccination. Not in Philadelphia. The age limit in the suburbs is 65. You have to be 65 or older, but in Philadelphia, 75 or older. So we also have other problems, with this patchwork, and we don't have consistency. And, you might say, well, New Jersey has a different set of rules, but at least it's a different state, So there's that. And I think that, anything that happens that makes someone feel that they're not being respected is going to make them that much more likely to just say, you know what, I'm just going to wait.
Mhm.
And I mean, most people are being forced to wait because there's such a limit in the vaccine. But but I feel if people have an opportunity, it would just be like really just sad, right? If they just felt like they can't trust this because of this stuff happening. It should never have been allowed to happen.
Yeah, it's definitely been the talk of the city of what's been happening, and what's going to be the outcome. And so, I think it's definitely something to be said in terms of the need to build trust, um, as a result of this, but also because of the existing mistrust that exists anyway within differing communities, right? And so let's do a temperature check and see what's going on in the chat room on Facebook. Kyle, can you check the Facebook chat and see if there's any questions, any comments?
We have a hello from Scott. Other than that, no questions, but we encourage folks to ask questions there.
Great. Thank you, Kyle. So, Jane, it sounds like Philadelphia Fight has been in existence for 30 years. We had an anniversary last year, and so we're working on year 31, and so we have been around for a very long time. And I think it's important for people to recognize that we're not new to advocacy and speaking truth to these issues, right? And that we're doing great work and educating the community on public health matters and also offering treatment, as you spoke to earlier. So, with that thought, Jane, where do you see the future of Philadelphia Fight, and how do you plan to build on its legacy with expert care and building trust in the community?
As relates to COVID, or you're saying more generally?
Just in general, yes.
In general. Well, I think that the direction where we were starting to move kind of before COVID happened, but where we are still starting to move, is to get out beyond Center City. And we are really hoping that we will be able to start creating more health centers that aren't in Center City. So, for example, we already do have a partnership with Norris Square Community Alliance, where for a pediatric clinic that is going to happen in an area of this, sort of in an area of Eastern North Philadelphia, close to Kensington, where there are almost no pediatricians in that area, so that we think that this is an opportunity. We've been talking to some people in West Philadelphia, not as far along, also some people in the Northeast. So I think that is one of the things that we're really hoping to do. One of the problems of being in Center City is parking, and the bigger we grow, the more it becomes a problem. This is particularly a problem for pediatrics because, you might have 3 kids and you really don't want to be taking them on SEPTA under the best of circumstances, let alone now. So I think that, that's one of the things that I think we're really going to be moving toward. I think a couple other programs that are starting up, even though we are still thinking thinking of like, how do we just keep functioning in this pandemic, is that we're beginning to have somewhat of a transformation of how we address substance use and early recovery in our health centers. We actually recently, for the first time, have been able to hire a director of all these programs in the health centers, and I'm looking forward to the changes that I think she'll be able to make, so that, you know, our services will be more accessible to people. I also just want to say, sort of at the shout out level, is that, you know, all of our education programs have done such a good job since the COVID pandemic started in pivoting to everything online. So, I mean, you know, CHTA was definitely kind of a pioneer, you know, the pioneer in being able to start putting programs up on the internet. AIDS Education Month last June, when I would say, you know, probably almost any organization would, except us, would have said, oh, we'll just do it next year. Right. And now look what happened. But you know, we actually did AIDS Education Month in the fall. ICJ also did an online version of their conference that, you know, that should have happened in the fall. Project Teach is now doing a full schedule of classes. We've all figured out in our different programs, you know, like how to hand out iPads and then hopefully also get them back, you know. To be able to, you know, to make participation something that's kind of more, you know, more possible. I mean, obviously there are things, you know, if somebody needs to come in and see their doctor after a certain point, you cannot do that with telemedicine. But, you know, almost all of our education programs have developed a really strong presence online. And I think that one of the things I think is going to grow out of this is that, for example, just take Teach. For years, you know, we've been trying to figure out a way to get Teach beyond just being in Philadelphia. And the COVID pandemic may have really shown us the way. I mean, we had finally started to, working with the state, have Teach classes in different parts of Pennsylvania, but, you know, of course, COVID happened. But you know, it's like I feel based on some things that I've heard from Teach that we're going to be able to actually expand. And I don't know about CHTA, but I would imagine that, you know, people sometimes or often tune into, you know, the programs that CHTA's doing. It's not limited anymore. So I think, you know, it's I hate to say silver lining about anything like this, right? But you know, but nevertheless, that may be a silver lining, that we're really going to be able to extend FIGHT's reach outside of just Philadelphia. And I would say that, you know, for AIDS and for people who are returning citizens and for people who just need accurate health information, you know, it's like being able to offer it in that way could make us, you know, could really make a difference in, you know, in people's lives. So I'm glad that we've been able to do it. This has been a good thing.
Yeah, you know, as you were talking, I was saying to myself, I said, Jane, you are absolutely correct. You know, um, during the time of COVID, I think everyone could relate to having to pivot, but also recognizing, wow, I've learned either some new skills to be able to manage, and out of it, with new opportunities that we probably would have never thought of had it not been for that, for, you know, for COVID and an unfortunate situation. But it's also exciting to hear about the expansions of different programs within Philadelphia Fight and the potential of expansion of relocation just to grow and have better accessibility for our consumers. And so that's great to hear that in the future of this organization. And so, to the viewers, if there's any questions, it'd be great to hear from you or any thoughts. Kyle, can you check in?
Yes, we have one question from Jeffrey who asks, can you clarify for me how federally qualified health centers will play a role in the federal plan for vaccination rollout? Now, I'm gathering that that is general questions about FQHC, and I guess we can clarify how FIGHT as well as an FQHC will factor into that.
Yeah, we are about to start vaccinating our patients, and we also are about to start vaccinating people who aren't our patients, sort of both. we would have been able to do more, except that, as you know, the supply of vaccine is incredibly limited. FQHC, so this is one thing that I think is kind of hopeful, which is that if the Biden plan, the 1.9 trillion plan passes, there is going to be money that will go directly to the FQHCs to address, COVID-19, but it will include vaccines. And they're also, this is not like as clear what this will mean. There also is something in there that that says that FQHCs will be able to order vaccine directly from the federal government. And right this minute, we can't do that. In the rest of the state, they order it through the state. In Philadelphia, we order it through the health department. And I think that, like not, maybe not having a middleman in between is, will help. Our plan is basically to create 2 vaccination centers for, one in each of the 2 buildings we have in Center City, to stay open after hours. I hope we'll also be able to do it on Saturdays. And the goal would be that we reach all of our patients. Now, the other thing that complicates this is, as I said, this Philadelphia has made up its own rules. And people who would be eligible in other parts of the state are not eligible. And since I'm thinking that this audience may be people with HIV, I would suggest to you that this ought to be an opportunity to organize around this, because there is no reason not to include people with HIV in group 1B. So the only way in which we can include most of our patients with HIV, which of course we will do, is if the patient has another condition that the city is counting. If you just read it, you got to read the fine print, because there's a statement that says something about lowered immunity, but it is only if the immunity is lowered as a result of an organ transplant, because people take drugs that lower immunity, not HIV. There ought to be advocacy. I would also mention that smoking, as of yesterday morning, so I assume they haven't changed it, if you smoke, you're eligible. If your provider doesn't know you smoke, you probably should tell them, no matter who your provider is. As an FQHC, we don't have much choice but to follow all of these rules. I think that, those entities that are big enough to think of themselves as bigger than the city are not always following the rules. So one positive thing that's happening in Philadelphia is that Jefferson Hospital has formed a partnership with the Black clergy. And clergy are able to get their shots now from Jefferson Hospital. Now, if you were a clergy person and you had an address in the suburbs, you would have been able to do that anyway, but not in Philadelphia. So if there's anyone listening who is in that category, if you get in touch with us, Calenthia Dowdy at FIGHT has the link, and we can get in touch with her, you can find out. So, but, that's something that they're doing in Philadelphia. They ought to. I'm not saying it's wrong, but I think they feel that they can stand up to the city. But anyway, but our goal is we will open 2 vaccination centers, and we will go through our patients as quickly as we possibly can.
Thank you, Jane. That was great information that you just shared. I'm sure it was informative to those who are listening. And so, Jane, I want to thank you for taking time out to share with us, as this brings us to the end of our CHTA chat. Kyle, before we close this episode, is there any last thoughts or comments in the chat room?
At this moment, no.
No. Okay. So if you're watching and you have further questions or thoughts, you can always leave a comment even after this recording. This recording will be available on our Facebook page. So have a great day. Jane, it was great seeing you with COVID. At least we have technology to see each other.
Yeah, I know. It's like, none of us get to see each other either.
Right. So everyone, have a great day, and thank you for tuning in to today's episode. Take care.